In Willowbrook, a tiny village, there lived a seasoned doctor named Dr. Samuel. He has served as the community's go-to physician for more than 30 years, earning a reputation for his kind disposition and unshakable devotion. His clinic was a charming structure with ivy growing up the brick walls. Every day, tales of hope, resiliency, and occasionally sadness were told there. When Dr. Samuel arrived at his clinic one beautiful fall morning, there was a long line of patients outside. Mrs. Evelyn Thompson, an energetic 80-year-old lady who loved to bake the tastiest apple pies in town, was one of them. She was in for her annual physical. The two of them talked about the impending harvest festival while Dr. Samuel examined her. Dr. Samuel pledged to visit and enjoy a slice of pie that Mrs. Thompson had promised to bake for the occasion. Tommy, a 10-year-old youngster with an insatiable curiosity and a penchant for getting into trouble, came next. He made a very daring attempt to scale the old oak tree in his garden, which resulted in a severe gash on his knee that he sustained today. As Dr. Samuel treated and bandaged Tommy's wound, he was animatedly told about his tree-climbing adventure. He knew full well that Tommy's spirit of adventure was not easily contained, so he gently admonished Tommy to use more caution. Dr. Samuel visited a range of patients throughout the day, each with a distinct story to tell. Mr. Robert, a retired educator, was present. He had just received a diabetes diagnosis. Dr. Samuel gave him more time and discussed the significance of food. Dr. Samuel received an urgent call in the afternoon from the nearby assisted living facility. One of the residents, Mrs. Margaret, had suffered a hip injury in a fall. Dr. Samuel came running over to check on her. Despite her agony, he discovered Mrs. Wilson to be cheerful and joked that she had always wanted to try out a wheelchair. With the promise to follow up later, Dr. Samuel made arrangements for her to be admitted to the hospital for additional assessment and care. Dr. Samuel returned to his office as the sun was setting and saw Emily, a young woman, waiting tensely. She had just found out she was pregnant and was new to the town. Feeling a mixture of worry and excitement, she went to see Dr. Samuel. When the day eventually came to a conclusion, Dr. Samuel sat at his desk and thought about all the lives he had impacted. Every patient served as a reminder of his decision to follow this route, with their own tales and difficulties. It was about becoming a part of a community, sharing in their joys and sorrows, and improving their lives, not simply about making medical diagnoses or prescribing remedies. Upon closing the clinic and exiting into the refreshing evening breeze, Dr. Samuel experienced a profound feeling of satisfaction. He was prepared to meet tomorrow's patients and tales with the same commitment and empathy that had characterized his professional life. In the center of Willowbrook, Dr. Samuel was more than just a doctor, he was a beacon of hope and care for all who crossed his path.